Hello, my name is Lisa Stewart, and I'm part of the Public and Patient Engagement team at PCORI. Our team's work supports researchers and partners funded by PCORI in realizing their engagement goals, and we work on projects that facilitate stronger engagement and partnerships through building an evidence base, developing resources, and sharing information about engagement practices more broadly. I'm pleased to share with you in this presentation a brief overview of PCORI and a snapshot of what we've learned about patient engagement thus far. PCORI's mission is to help people make informed healthcare decisions and improve healthcare delivery and outcomes by producing and promoting evidence-based information that is guided by patients, caregivers, and other healthcare stakeholders. We do this by investing in research studies, investing in projects, activities, and resources that support research and the dissemination of findings, and creating products that synthesize and map existing evidence. PCOR, or Patient-Centered Outcomes Research, places a tremendous value on the lived experience of patients and caregivers and other stakeholders. It is our belief that engagement improves the trustworthiness of research and its ability to be implemented more quickly. PCOR brings together two concepts, patient-centeredness and patient engagement, that are critical and interrelated. Patient-centeredness, as we think about it, is the extent to which a proposed study, question, and outcomes are of importance to patients and their caregivers. The extent to which interventions being studied are accessible to patients and stakeholders, and the extent to which participating in the study is minimally disruptive to study participants. Patient and stakeholder engagement, as we think of it, is an intervention that helps studies achieve patient-centeredness. From a patient or patient organization's view, it is the process of partnering with researchers and leveraging your lived experience so that research is more relevant and pragmatic. What have we learned? When PCORI began and first established engagement as a requirement, there was no evidence that engagement made a true difference. There was also little guidance on how to do it. We were intentionally non-directive to encourage creativity, to allow PIs and research teams to best determine what would work for them. Since those early days, PCORI has learned a lot, taking advantage of our rich and varied portfolio to learn about engagement practices in different settings and different contexts. The information I'm about to share represents a synthesis of practice-based learnings, data taken from project monitoring and surveying and interviewing funded researchers and stakeholder partners, and the results of a large-scale study that included 120 in-depth interviews. We are learning that engagement is, in fact, making a meaningful difference. We now have evidence that what we originally hoped for about engagement is actually occurring. We know that engagement is influencing how a study is conceptualized, how it is implemented, the study materials used for recruitment and training study staff, and is influencing the design and implementation of engagement itself. Overall, researchers are developing a much fuller understanding of the needs and concerns of stakeholders. In one study, for example, that looked across 58 projects and included 1-hour length interviews with investigators and stakeholder partners, there were recorded more than 400 distinct examples of how engagement influenced study conduct. One thing that we know for sure is that one size does not fit all. Engagement can look different in different partnerships. This picture shows different levels of involvement without value given to any particular one, from patient and stakeholders providing unidirectional input, that is, not engaged as ongoing partners, to patients and stakeholders functioning as partners, occupying roles of increased responsibility and increased involvement in decision-making. Within studies, we may find all of these forms operating at different times or at the same time. In our research study, we saw teams travel along this continuum based on a task at hand. It could be that a focus group is needed for a specific task, and patient or stakeholder leadership is best for others. The big takeaway here is that engagement is iterative, it is dynamic, it involves flexibility, and often requires different methods to reach different groups. Another way to consider the effects of engagement is to think about its impact. In an earlier slide, you may recall we looked at what is being influenced. Again, study conception, execution, the broadening of knowledge of stakeholder interests. This slide now shows us the impacts, or that so what, from the standpoint of patients and researchers in another useful way. Our large-scale study showed evidence that engagement has these impacts. It has an impact on user orientation and acceptability. This refers to a patient's willingness to participate in a study based on the burden, the usability, and the alignment with their own preferences and values. Its impacts are felt in the feasibility. This means how doable the project is in a real-world setting. The impacts extend to study quality, which takes into account the rigor and the comprehensiveness of the study and the quality of materials and products of the study. It impacts the relevance, which refers to the applicability of the results and its importance for patient decision making. And it also impacts the scope and quality of the engagement itself. Now, moving beyond the research projects and looking at benefits that accrue to the people and organizations involved, you see here some of the findings from a qualitative study of PCORI research partners and what they reported in terms of benefits. On the individual level, patients reported, among other things, that their experiences with engagement resulted in more enthusiasm for research. It resulted in them acquiring new skills and professional opportunities. It resulted in a better management of their own health condition. They were rewarded with relationships that lasted beyond the study itself, and they felt an overall satisfaction of feeling like they were making a difference for future patients. We heard from community and patient orgs that engagement helped build trust with other stakeholder groups, and it strengthened those relationships and increased their awareness of different stakeholder perspectives, and at the same time increased their capacity to do research again. This slide categorizes the types of challenges shared by patients. So while there are many rewards, there are challenges too. Engagement can be hard and difficult. It requires bringing a multiplicity of perspectives together. And so what you see here are a number of areas that have been categorized around those challenges to help us categorize those challenges. So within infrastructure and resources, this refers to how do people, or what is the knowledge and skills that people need to actually partner? What is the burden of time? What is the burden upon resources? Does your organization or you as an individual have those resources to spare? On the level of people and teams, what we know is that there are many questions around access that need to be addressed, as well as ensuring that diversity and inclusivity happens. So we should ask ourselves, patient partners should ask themselves, who are you representing? How have you ensured to bring in other perspectives other than your own? And how will you extend the reach and bring those perspectives into the room? We also know that there's many challenges for organizations and that there's an ongoing challenge of balancing the many different perspectives such that you avoid, or the team avoids, conflict and that they hear each other's concerns. We also have evidence that PCORI's approach to engagement is influencing the culture of healthcare research more broadly to be more patient-centered by inspiring and catalyzing changes at other organizations and institutions. Here are some of the activities that we see occurring now. You see more seed funding for partnerships, more trainings available for students and research partners, more opportunities for patient partners to be reviewers in the application process or in manuscripts submitted to journals. We're also seeing just a much more wider spread adoption of policies that support and encourage engagement. In closing, what also has been validated in our research is that engagement requires careful planning. When a patient or patient organization and researcher decide to partner, they embark on a journey together that can take up to a year or much more to go from conceptualizing a project to submitting an application for funding to learning if that project was funded or not. And an application to PCORI was described for engagement may be very high level or based on an ideal scenario that has changed from the time of award. PCORI thus requires awardees to submit after they've been awarded a startup plan, a very detailed plan for how engagement will be operationalized and set itself up for success. This slide contains the key areas that we ask about to get to when a project stands up their engagement infrastructure, what could be helpful as guidance for anyone who is planning an engagement strategy. It's always helpful to think about the goals, who's represented, who's going to be coordinating engagement, how are you going to manage the engagement governance, and how are you going to structure it, as well as what do partners need to prepare. And lastly, I want to point you to resources that are available on PCORI's website. Please use them liberally and share them generously. Building a more inclusive culture and research takes the will and the participation of many. I wish you much success in all your efforts in helping us to collectively reach that goal. Thank you.